I'm Ralph Preston. William Lowe and I are back again for another roadmap. And tonight we're going to do a second talk on spasticity. We did one a while back, but we got in the survey that we did, we got asked for more help with spasticity. So we're calling this spasticity help or spasticity 2. And one of the things that I found key to getting rid of my spasticity was stretching and range of motion exercises. So most everything we're going to talk about is going to get back to that eventually. I know, William, you have some thoughts on the basics of dealing with spasticity post-stroke. So why don't you start us off?
Yeah, sure thing. So I think when it comes to recovery after stroke, addressing spasticity should be one of the key things to tackle, especially early on in your recovery after stroke. Because for those folks who are watching this, who may be in the early stages of your recovery after stroke, Ralph and I have been in the game for a long, long time. Myself 10 years, Ralph probably even longer. And we've seen a lot of we've seen a lot of stroke survivors, and we've spoken to a lot of stroke survivors. And as someone who personally coaches stroke survivors in their recovery after stroke, one of the things I see a lot is a stroke survivor who years after their stroke, their hand is still balled up in a fist like that. And this makes me really sad all the time, because I know that could have been prevented had they had a game plan put into place when they first had their stroke to help address the spasticity. Because at the end of the day, spasticity is basically a situation where your brain doesn't know how to regulate the signals it's sending from your brain to turn on and turn off muscles properly. Or in other words, be able to contract and relax muscles at the same time. So I think early on in your recovery after stroke, if you really want to set yourself up for success, one of the most important things to do is to actually have a game plan in place to actually address your spasticity. And the reason why I say this is important is because if you can stretch out your muscles early before they become too tight, then you can avoid the situation where years down the track or months down the track, when the tightness or the muscle tightness or the muscle spasticity becomes worse, that your hand is brought up in a fist like this, and it's almost impossible to fix. And if there's one thing Ralph and I have learned in recovery after stroke, it's much harder to fix a learned habit. In other words, the habit of your muscles being really tight and clenching like this, than it is to teach your brain a new habit. So when it comes to addressing spasticity, I 100% agree with what Ralph said, in that I think that stretching is paramount, because what stretching does, and they've actually done research on this, is that whenever you actually stretch a muscle, your brain actually sends a signal to turn on that muscle and relax at the same time. So early on in recovery after stroke, what we know is that your muscle spasticity is going to kick in after the first week of your stroke recovery. The first week, your muscles are going to be quite lax. They're going to be quite flaccid. But after that, that's when the muscle spasticity kicks in. And when it comes to addressing spasticity, it's a lot easier to kill the beast when it's small than to try and address it later on down the track, when, like I said, it becomes almost impossible to address when your hand is brought up in a fist like that, and your arm might be clenched, flexing close to your chest. This is almost an impossible situation to get out of, but it is a situation which can be prevented if you have a plan in place in the early days of your recovery to address this. So I think when it comes to spasticity, one thing which I found extremely beneficial in my own recovery, as well as one I've seen to be really beneficial in other stroke survivors' recoveries who I've exchanged notes with, is just constantly stretching and just really keeping yourself accountable for making sure that whenever you have the time And whenever you're doing nothing, such as watching TV or maybe you are traveling out and about, making sure that you keep yourself accountable for keeping your affected hand stretched out. And what this could mean is, for example, whenever you're watching TV, you're using your unaffected hand to stretch out your affected hand to make sure that it's not allowed to be flexed in and closed in like a fist. And when you're constantly giving your hand this attention, what you're doing is obviously one, you're not allowing your brain to get away with having a closed fist all the time as a default position, but you're also making sure that your brain is able to preserve the length of the muscles in your recovery after stroke. Because one thing happens in recovery after stroke, and this goes hand in hand with spasticity, is that your muscles actually shorten. So basically the length of the muscles, as you go on and about in your recovery, it becomes a lot harder to turn them on because the muscle length, it actually shortens. And if you think about a rubber band, it's quite efficient when it's pulled, but when it becomes cold, it becomes quite hard to pull the rubber band, and it's not very easy to do. And the elasticity and the stretchability of the muscle band becomes a lot less when it's put in a certain position. So if you maintain a rigorous stretching program and you're constantly keeping yourself accountable for keeping your muscles stretched using your unaffected hand to do so, then you can not only reduce the spasticity, but you can at least keep it at bay, which can allow you to actually get back more use of your upper arm and also your fingers at the same time. One stretch I found really beneficial, alongside just making sure that your fingers are stretched out whenever you have free time, is just doing a simple weight bearing stretch. And basically what that would consist of is where you're standing up and let's say you're facing a TV, and you would put your hand splayed out on a big book while using your unaffected hand to keep your affected fingers straight and in a stretched out position. And what you can do when you're doing this is you can use the weight of your shoulder or the weight of your body to push down onto your affected hand while keeping your fingers straight. And if you can maintain this position for maybe 20 minutes or 30 minutes at a time while facing the television, what this can do is this can actually stretch out all of the muscles in your forearm, which are responsible for making your fingers flex in. In other words, your wrist flexors or your finger flexors. So I think that if you can adopt that weight bearing stretch as part of a stretching program, as well as just keeping yourself accountable for keeping your fingers stretched out throughout the day whenever you have free time, then that's one way you can really, really help address the spasticity. And not only that, you can also prevent the muscle shortening, which occurs in recovery after stroke, and also preserve the blueprint in your brain, which is responsible for your hand. Because in recovery after stroke, for those of you who might have seen my presentation on the blueprints, on the blueprint for the brain, which Ralph can probably put a link below on, I talk about how your brain develops a blueprint for how it used to perform movements before your stroke. Now, in order to preserve that blueprint, stretching is a way to actually preserve that blueprint. And the way it does this is by keeping that spasticity at bay so that your brain actually doesn't develop bad habits through that muscle tightness. Because as your muscles become a lot more tighter, your brain is naturally going to compensate by using other muscles to try and get the job done, which is why if you're a stroke survivor, you might have noticed that whenever you lift up your arm, you might not lift it up forward with ease, but rather you might find that you might use your shoulder and your trunk to get it up. Well, the reason why that happens is because that's spasticity or muscle tightness, which is forcing your brain to use other muscles to get the job done by compensating as a way to overcome that muscle tightness. But if you've got a stretching program in place to prevent that muscle spasticity or that muscle tightness from getting too much, then you might find that your brain won't have to compensate as much to lift up your arm, and you'll be able to perform movements with your hand and your arm with a lot more ease, um, and without as much restriction than if you had muscle spasticity to deal with at the same time. So that's basically one of the most important things I think to keep in mind when it comes to keeping spasticity at bay. I think stretching is really paramount, but the most important thing with it is that you've got to stay disciplined with it, especially in the early days of your recovery after stroke. If you're someone who is watching this and you're wondering how to set yourself up for success in your recovery, I would highly recommend that you really take into consideration the idea of putting in place a really disciplined and strict stretching program, which you can follow on a day-to-day basis so that you can keep that muscle tightness at bay, which in the long term, will allow you to learn how to perform movements like you did before you had your stroke, because your brain doesn't have to overcome any resistance caused by the muscle tightness or muscle spasticity when it's trying to learn how to do something it used to before you had your stroke. Now, Ralph, before we sat down to have this discussion, you and we had a chat about stretching and how you use this in your recovery to help yourself in your own journey. I'm just wondering, would you like to share your thoughts and your experiences on stretching with the folks watching?
Sure. I don't think I heard. I couldn't tell you when I first heard the word spasticity. It wasn't something that my physical therapist or occupational therapist really talked about. I mean, I knew what it was because I had it. I had tightness, and everything that I pay attention to what's going on around me, and it seemed like the PTs and OTs were working against the tightness. So that's basically what I did. If my arm wanted to come in, I would work on like pushing it away. If my hand was not in a real tight fist, but it was in a fist, so I worked on opening it. I always fought against the tightness, against the spasticity. And like I said, I don't think I knew that word. I didn't really know what I was doing, but I kind of, like I said, paid attention in PT and OT, and that's what they seemed to be doing. So I kind of continued that kind of some of the same exercises, and also the kind of the same theory behind what I was doing. And in the early days, when I couldn't move, when I couldn't do something, like open my elbow all the way, I would put my elbow on something and I would passively move. If whenever you passively move, you go to open your elbow and it starts hurting here, you don't want to push into that too much. I always pushed, whenever I hit pain, I would stop. I would push just barely into it and try and move the pain zone farther and farther away, which is what I eventually did. So that I think I got 180 degrees there, nice and straight. I don't have to push down. It doesn't hurt at all. And I don't have anything like trying to bring it back up. So basically I used, not knowing what I was doing again. I had this, pretty cool recovery considering I did most everything the right way, and had no idea that was the right way until later when I learned stuff. But so I did a lot of stretching and then range of motion exercises. And in my case, my spasticity started to diminish when I got full range of motion in various muscles. And then once I had the full range of motion, starting with passive motion to active motion and to going all the way through a complete range of motion, I noticed sometimes I'd have like bumps, weaknesses. I had weakness in this arm, like right about here. I wanted to fall. So I worked on that, and I introduced small weights in some cases. I'm not a big believer in big heavy weights, so I'd like repetition and light weights. But I introduced weights to try and build up some of those muscles. And as I got strength back throughout the range of motion with none of those bumps or weak spots, that's when it continued to go away. So that was my experience with it. I knew since we'd already done one of these, and I knew you'd probably cover a lot of the basics. I also went into did a little looking up on the internet to see what else I could bring to this conversation. And one website said the natural way to get rid of spasticity: number one, range of motion exercises; number two, adaptive yoga. They also said CBD, THC, cherry juice, and warm water. Hadn't heard of the last couple. No, don't really know about them. One thing that I found is beneficial, but this is more after I got rid of my spasticity, but I know stroke survivors who found it real beneficial, is that massage can sometimes help with spasticity. This could be a professional massage. It could also be somebody in your life that is willing to do some simple massage. What else did I discover? Oh, there were a number of sites that said hydration is real important. If staying hydrated is important. Let's see what else. Oh, one said, what's the best vitamin for spasticity? And it was magnesium. Oddly enough, magnesium's what they give you for jumpy leg syndrome, which is a form of muscle spasms. Spasticity is just extreme muscle spasms where your brain won't shut off and it just keeps tightening and tightening the muscle. Another article that I looked at said that if you were low in vitamin D, and at least in America, something like 95% of us are, that you're being low in vitamin D can cause more you to have increased spasticity. You know, all these things are things that people have observed or they've done studies on, which is basically where they observe a lot of people in a group and they make generalizations like, you know, mostly work for everybody. But there are always people that didn't work for and such. So what I'm telling you here is this is, again, something you have to pay attention to in your own body and your own recovery. How many times will we come back to this, William? Paying attention and what's going on with you is really key to recovery because, you know, you can read it on the internet, you can read it in a book, your PT can tell you, but sometimes your body doesn't behave the way it says in the book or on the website article that you read. So you have to see if these things work for you, and if they help, then you know maybe you can do more of them, and if they don't help, then maybe you should move on to other things. So those were a couple of other things that I discovered. I got better, like I said, through the basic work against the tightness, open muscles up with the other hand, passive movement. I did a lot of mental imagery or mental practice. That's when you open it up with your other hand. Whatever you're doing, that you imagine that you're moving it. And what you want to do is get from where you are moving it and thinking about it to be stronger and stronger on your thinking so that eventually you can move it on your own, active movement instead of passive movement. So that's, I mean, a lot of this stuff points back to range of motion exercises. So I think they're key, and stretching I found to be very beneficial for me. William, I know you had a couple other points, so I'll toss it back to you. Actually, you're that way.
Yeah, sure. So for those folks who are watching this, you're probably wondering, well, what if you're in a place of recovery, in your recovery, where maybe it's really, really challenging to stretch out your muscles because the muscle spasticity is too much? Well, in these cases, not all hope is lost. And what I'll suggest is exploring alternative ways to actually educate your brain how to control the spasticity. Because, like Ralph said, spasticity at the end of the day, it's basically your brain sending signals in such a way that it doesn't know how to turn off. So in these scenarios where maybe you're in a situation in your recovery where it's quite difficult or quite challenging to actually stretch out your muscles, because maybe your hand is brought up in a fist, or as some stroke survivors have mentioned, or maybe your arm is close to your chest like this and you can't bring it out. One possible way to actually address spasticity in the chronic stages of your recovery, in other words, if you're 6 months post-stroke or maybe a year post-stroke or more, I would suggest looking into something called electrical stimulation. And I would recommend this to people who are not on a pacemaker or not on a heart monitor, because electrical stimulation for those of you who are watching this who haven't heard of it, it's basically a way to help teach your brain how to perform movements it used to before you had your stroke, through the use of using electrodes to actually help teach your brain how to turn on and turn off muscles like it used to before. So electrical stimulation, basically what you would do is you would have a machine and you would put electrodes on certain muscles to teach your brain how to perform certain movements. And what this does is it actually can. The way I like to think of it is I like to think of electrical stimulation as training wheels for your recovery after stroke, in that how you would learn how to ride a push bike. Initially, you would learn how to gain your sense of balance by using some training wheels on the side. Well, electrical stimulation is the same thing, but to your recovery after stroke, because with electrical stimulation, what you can do is you can not only allow your brain to actually see what it looks like to turn on muscles and turn off muscles. In other words, open your hand and close your hand, but you can also feel what it feels like to actually open and close your hand using electrical stimulation or using electricity to stimulate the muscles, which are used to open and close your hand before your stroke. And what electrical stimulation does, and the good thing about electrical stimulation, is by guiding your brain through the motion of a movement which you're trying to learn, such as opening and closing your hand, what this in turn is doing is it's also stretching out the muscles, and at the same time, it's also re-educating your brain on the correct way it needs to send the signals to perform a movement which you might have done before you actually had your stroke. So I would highly recommend, if you're in the late stages of your recovery, let's say 6 months post-stroke or a year plus, to look into the use of electrical stimulation if you're not on a pacemaker, because when done right and when it's especially targeted, it can really help your recovery and re-educate your brain on how to send those signals and regulate them in such a way that your muscle spasticity is actually reduced. Because at the end of the day, like Ralph said, spasticity is caused by your brain just being overexcited and sending those signals in such a way that it doesn't know how to turn off. And just going alongside with electrical stimulation, another thing I would also recommend is muscle relaxants. And this is something which Ralph and I had a discussion about earlier. So in recovery after stroke, there are certain drugs which you can take, which are called muscle relaxants, and they can actually help teach your brain to reduce the amount of signals which it's sending, or in other words, to switch off, so that muscle spasticity is reduced or relieved for a certain amount of time while after you've taken the drug. And in recovery after stroke, one of the go-to one of the drugs which a lot of stroke survivors have found beneficial in their recovery is something which is called Baclofen, which is basically a drug which you take, which addresses the muscle spasticity from the spinal level. In other words, when you take it, it actually calms down the brain, and it stops your brain from sending too many signals. It stops your brain from sending more signals than necessary to certain muscles to turn them on. And by doing this, it actually allows all your muscles to it actually allows your whole body to relax, with the downside of also making you tired at the same time. So that's just one area to explore when it comes to relieving spasticity. And I think if you take into consideration the options that Ralph and I have shared with you guys so far, you might be able to come up with some things, some options which you could consider when it comes to creating a plan for yourself to help reduce spasticity in your recovery and manage it in such a way that it fits in with your lifestyle as well. So those are two other options which I think are really important in recovery after stroke, when it comes to addressing muscle tightness or spasticity. And Ralph, I know earlier we had a discussion about this, and you had some thoughts. I was just wondering if you want to share them with the folks watching. I'll just toss it back to you.
Sure. A couple of quick things. I looked up all the various things that I run a bunch of groups, so I see a lot of posts, and I see, people saying various things that helped them actually in a natural way. I mentioned CBD, THC. Some people say that those help them. Few people say muscle relaxers. When I looked up muscle relaxers, said that they sometimes work on spasticity. I don't think Baclofen's classified strictly as a muscle relaxer because there's some neuro aspect to it in terms of it dialing down the amount of signals that your brain sends to your rest of your body and to your muscles. Baclofen does tend to make a lot of people tired. If you're on it once a day, one thing you can do is take it at night after you discuss it with whoever prescribed it to you, because I don't ever tell anybody to change their routine. I tell them to talk to their doctor about it. That's one thing that seems to have worked for a number of people. So a few people say gabapentin. I didn't have much luck with it on anything. So again, a few people will say that. A good number of people say Baclofen works for them. And of course, the elephant in the room is Botox. So we could probably, need to do a whole nother segment on Botox. Although actually I've done a couple on some other talks that I have. I could post them in the comments here. Botox is, I did an interview with a neuro PT in England, and they tend to prescribe Botox early on. And you have to be careful with Botox in the sense that you don't want to be giving it while you're flaccid in the early stages, because it won't help. And you also need to go to somebody who knows what they're doing. There's some new techniques for guiding where they put it, ultrasound and other things. So somebody who does that versus the old-fashioned stabbing it in the muscle, although doctors are supposed to know where all the muscles and nerves and everything are. So that way worked for a long time. But the most important takeaway I got from talking with Tom Haynes was that Botox is effective, but you have to be careful when you use it and use it at the right time. I also personally know 2 stroke survivors that got Botox at the wrong time, and it interrupted their recovery programs for a number of weeks until it wore off. So Um, it does work well for a lot of people, but it's something you need to make sure that you're at the right stages with, and something that you want to make sure you have a knowledgeable practitioner that you're working with who's going to administer it. And my standard thing with Botox is all it does is loosen you up so you can do the range of motion exercises. To me, it all comes back to those range of motion exercises, because the whole purpose of Botox is to stop the muscles that are keeping you from opening or moving in whatever direction they're giving you for. Different for hands and arms and legs and things, but generally they're giving it to tone down those muscles, much like the way Baclofen works to reduce the signals, but this is on a physical level. So, but it doesn't do anything on its own. If you wait, 2 or 3 months it's supposed to last, and you don't do anything, you'll go right back to where you are. I followed a few people on a Botox study with a neurologist at the Medical University of South Carolina. I can tell you that I'm not privy to whether they did their exercises or not, but I was there when the OT asked them, and the people that said kind of didn't do as well as the people who said, yeah, I did my exercises all the time. So Botox doesn't do anything on its own. It's not a miracle thing. You're back to the whole range of motion thing. I don't think there's any real way to get rid of spasticity. This is my opinion based on my experience, without doing the work, without doing the stretching and the range of motion stuff. It's just that seems to be the most effective way. And things like Baclofen and Botox and hot and cold and all the things that people try that they say reduces it, are all to get back to being able to do those range of motion exercises, because ultimately that's what shuts down or shuts down the excessive signals and gets you back into like where your brain is sending the right amount of signals to the right places, and those places are responding. So that's what I think about that's what I looked up and what I know from my experience about the various drugs out there. And I know, that was like a 40,000-foot view on Botox, but I felt maybe we should touch on it at least here, since it's a go-to thing for a lot of people who have severe spasticity. In the US, we seem to wait a long time before we give people Botox. Like I said, in England, Tom felt that some people get it too early. I feel like a lot of people seem to get it too late here. And like William was saying earlier, the longer you go with that clenched fist or the pinned arm or a spastic leg or anything, the harder it gets to get rid of it, because of muscle shortening, and your brain gets used to it and all kinds of things. So like anything in stroke recovery, the more you can jump on it in the beginning, the better. I know that doesn't do any good to people who are 3, 5, 7 years out listening to this, because you can't go back in time. But just because I'm not a big believer in that you're trapped in anything just because you didn't do it. If you didn't jump on it, there's still a chance. I have a friend who got her hand back doing housework after 5 years. I got another friend who ignored her hand for 9 years and about 2 years into it and doing pretty good with it. So neuroplasticity lasts a lifetime. And we could probably talk about all this for a lifetime, William, but I'll toss it back to you and see if you got any additional thoughts.
Yeah. I mean, I just want to add on to what you mentioned about Botox. So I'm a big advocate of Botox. I think that like Ralph said, when it's given at the right time, it can be extremely beneficial for your recovery. But by itself it does nothing. Botox only really works when you're doing it, when you're getting it in tandem with a strict exercise program, as well as with a strict disciplined stretch regime, which you've got put in place. Because, like Ralph said, at the end of the day, spasticity is caused by your brain being overexcited and not being able to send those signals. And your brain is actually getting in the way of itself when it's trying to learn new movements. So we want to imagine that spasticity is a thing which is getting in the way of our brain actually wanting to learn things. So I think that Botox is extremely important because, like Ralph said, it has a different approach compared to Baclofen. The good thing about Botox, at least in my view, is that it's more localized and it's more targeted in that you can actually inject the problematic muscle which is causing you the muscle tightness in the first place. So, for example, if you're a stroke survivor and you're in a situation where your fingers are brought up in a fist like so, then it would make sense to get Botox injections for the muscles which you use to flex your fingers. Because by getting Botox in the muscles which you use to flex your fingers and also your wrist, then it's likely that these muscles are able to relax and it can allow you to actually teach your brain how to open up your hand. Because your brain doesn't have to go against that resistance of your fingers having to be brought up all the time. So that's why I think Botox is really beneficial, because if you can target a problematic muscle, such as a muscle which you use to flex your wrist and your fingers, which are causing your hand to be brought up in a fist like that, after the Botox, what you can expect to happen is that these muscles actually relax and it allows your fingers to be in a more opened up position. When it's in a more opened up position, you can also combine that with a strict stretching program where you can stretch out these muscles so that once the Botox wears off, your hand will be in a much more open and relaxed state, which will allow you to do your exercises more effectively and also allow your brain to learn how to send those signals even better than before you actually had the Botox. Because, like I said, at the end of the day, the muscle spasticity, quite often in more cases than not, it gets in the way of your brain actually wanting to learn something. Whenever your brain tries to learn a movement, and let's say you're trying to lift up your arm, if you can't lift it up like this and you're lifting it up like that, it's likely that there's some muscle tightness or muscle spasticity which is getting in the way, and your brain is using another muscle to compensate or overcome that muscle tightness. But the end product is a movement which isn't very isn't as good as it could be, because you have that muscle tightness in place. So I think at the end of the day, basically what Ralph and I are saying is that when it comes to reducing spasticity, the most important thing is to be very strategic about it. And I think, at least from my end, having a very strict, consistent stretching regime, which you do every single day, like a habit and a ritual, and also combining this with your other options, such as your electrical stimulation or muscle relaxants, whichever you find which would be beneficial to you. All of these can actually be really beneficial in reducing that spasticity and allowing your muscles to stay relaxed so that you can actually perform exercises or use your hand and arm or your legs in a more efficient way, so that you're able to guide your brain to connect the dots a lot quicker in your recovery after stroke. At the end of the day, your brain is getting in its own way, because spasticity, like Ralph said, is caused by your brain being overexcited and it's sending too many signals as possible. If you can dampen down these signals from the brain, and you can teach the brain to control those signals and get control over that spasticity, then at the end of the day, if you get really good at it, then you can essentially get to a place where your brain has learned how to regulate those signals properly, and that spasticity will be expected to get less and less, because you've followed this strict program and you've done your exercise at the same time to teach your brain how it used to do things before you actually had your stroke. But maybe it might be in a different way, but an even better way, because your brain is trying to put the pieces together after your stroke. Anyway, so that's basically everything I have to add. And I'll just toss it back to you, Ralph. Is there anything else you want to add to the discussion?
Sure. There are a couple things that they're just kind of random. They're left on, but I think they're valid and worth mentioning. Number one is no discussion on spasticity would be complete without saying that it's velocity or speed based. So if you're subject to bad spasticity, be careful about doing things too fast, because fast motion will bring it on. So that's one thing. Some people, some people, in fact, I know somebody who has extreme spasticity, and she's used splinting and bracing. Well, her doctors have. It's not something you do yourself. But that's pretty extreme in terms of, well, you have splints and braces. They make orthosis for you. And it's really mostly for people who have serious spasticity that causes them problems or serious pain from it. So I just thought I'd mention that. And then for those of you who like the latest and greatest, I didn't get a chance to really research this much, but I typed in like, what's the latest in spasticity treatment, and it came up with something called a Myoregulator that supposedly is going to help with spasticity without using drugs or surgery. It's kind of new. I don't know much about it. But it sounds interesting. Anything that doesn't use surgery or drugs is good. So if you're a person who likes new technology and you like to Google, I suggest that you might Google that. So William, unless you got anything else, I'd say we close this out and see everybody next time.
No, I don't think I have anything else to add. I just hope everyone watching this can really take into consideration all of the options that Ralph and I have discussed. Like we said, at the end of the day, it comes down to having a very strict stretching program, along with the exercises that you've been given in your recovery. Ralph and I have discussed some options you can investigate if you're further down in your recovery and maybe stretching is quite challenging for you. Electrical stimulation, muscle relaxants. These are all options for you to explore. Everyone's stroke recovery is different, so one may work for a person and one might not work for another person. But at the end of the day, stretching is something which everyone can do, and it's something which has been shown to get results in recovery when it comes to relieving that muscle tightness or spasticity and putting it at bay so that you can actually allow your brain to connect the dots a lot better in your recovery after stroke and live a higher quality of life, hopefully.
Okay. So, really comes down to paying attention to your recovery in your body. Again, what works for you. What you're trying to do is reduce the amount of signals so that you can do the range of motion and stretching. And those things are things that work for me, and they work for basically everybody I've worked with in person or talked to. So what you're trying to do is get loosened up, get the brain to where it's not overriding everything, and so that you can do your stretching and range of motion exercises. Because to me, that's, well, I can only go by my own experience, and that's what got rid of it for me. And so I hope that'll get rid of it for you. So, William, thanks for your time, and everybody out there watching, thanks for tuning in, and we'll see you next time. The next one of these that we have scheduled is going to be on alternate therapies. Should be interesting. Different things you can do other than just the basic traditional PTOT. So come back and join us again. And once again, William, thank you for your time.
Great. Thanks, Ralph.